the drop table does. Good. Good. Hey everybody, Dr. Rady, Kalkstein Family Chiropractic. I have Gail in the office. Why don't you tell them what's bothering you and then we'll get to work on you.
My upper left shoulder and the middle back.
Sinuses, knees,
Sinuses,
anything?
yes.
Sinuses? Okay,
Yes, yes.
face down for me.
Okay, sure.
We'll do sinuses, which I normally do on him, especially this time of year. Everybody's sinuses are bad. A lot of colds and things like that, so we can help that. Then you say middle back, you say lower through here or more upper between your shoulder blades?
The upper and the...
So pain between the shoulder blades, into his left shoulder, sort of the top of your shoulder, Gail, or more out behind in the back?
Where you were, right there.
Top of the shoulder. So this is his left trap. There's a muscle called your levator scap muscle that attaches to this inferior, superior aspect of your scapula and then runs up to your neck. It's a super common problem in the office. Everybody gets these knots in their shoulders. One of the things this time of year, it's cold out. We're always, our shoulders are sort of scrunched up, so like that muscle gets tight. Or if your head's down, whether you're working from home or you're working, doing a lot of like desk work, computer work. So with your head down, that pulls on this levator scap, which runs up to your neck. We're supposed to have our neck, that curved back. So a lot of postural stress, or like I said, this time of year with the cold weather, we get those tight shoulders and neck, a lot of neck pain, headaches. It's a good idea to come in to get adjusted, let us fix it, get to the root cause of the problem. Don't take medications and things, don't deal with it at home. That way we can get to the root cause of it so it doesn't become a chronic thing for you. Because that can also lead to headaches. A lot of like uneven, tight muscles, like I said, the trap and the levator scap muscles and rhomboids of the shoulder that also can affect your upper neck, which we'll adjust on him. So we do it in the office, which I've seen all my videos. I start with some soft tissue. You say it's your left shoulder, right? So we're gonna get right on that, where that levator scap inserts, which is right that part of the scapula. And then we'll just kind of work that, kind of how it goes up into the neck. Also on his left trap muscle, trapezius muscle, which comes way out and attaches to the acromion process out here on the scapula. And then runs along the top of the scapula up into his cervical spine. What happens is the soft tissue muscles develop adhesions, almost like glue, like a super glue that's built up in these muscles. And when that happens, those muscles don't fire and function the way they potentially could for you. When those muscles, when you have adhesions develop and the muscles don't function and fire properly, then ligaments and tendons start to take over and do more work than they should, than they're ever designed to do. And that's how you can end up with more serious like sprains and strains and more serious problems that way. So part of the reason we do the soft tissue is to break up any muscle adhesions that build up. Like people call them knots, really they're little pockets of inflammation. He has them certainly through his left shoulder here. So for instance, somebody who lets this go, just takes medications, masks the pain, they could end up with like a shoulder tendonitis or rotator cuff sprain because of the dysfunction in the joints here and the tightness in these muscles that I'm working on now. Take a deep breath in, exhale. Let that arm relax for me, yeah.
Sure.
That's it. Low back's okay?
Yeah.
I'll check it real quick. In our office, we adjust everybody full spine. So no matter what's bothering you, I want to focus on his shoulder, neck, sinuses, but I'm going to adjust full spine. Love the drop table work for low back, hip pain. Everybody's spine's different, and when I get you on the table, I can kind of palpate and feel. So he has this. We all have a thoracic kyphosis, it's called. So this part of your spine has this C curve this way, whereas the lumbar spine goes in. Same thing with the neck. The apex of his curve is much lower than what's normal. So he kind of gets because of that, he has this sharp angle down. So he sometimes gets a lot of like stress built up in this part of what's called his QL, quadratus lumborum muscle, just because of the nature of his spine. That's one of the benefits of coming in and having us check your posture and palpate your spine is we can look, you may have some postural things that are creating much, a lot of stress build up and back problems in this case. So he has so much tightness right through here because of the sharp angle from this part of his spine down. So what I like to do for him is, I'm on the table, our other table is a flexion distraction. We have some tables and some techniques to help sort of flatten that angle out a little bit. The drop table's up. That's why a lot of times he comes in, his other main problem is through here and through his hip. All right, Gail, face up. This is more of a facing education. Yeah, face up, let's get that neck adjusted. Usually get pretty good movement in his neck. It's kind of tough to adjust. Everybody adjusts differently. Some people adjust real easy, some are a little tougher to adjust. That's okay. Just relax your shoulders again. Good. This one here, relax your shoulders again. Good. Traction, I'll do your sinuses. Pick your head up for me. Relax it, just can decompress the cervical spine. You okay?
Mm-hmm.
Just basically pulling his occiput off his C1. But it's also sort of decompressing the whole neck. And we have patients that can feel this even into their mid-back or low back. This like decompressive effect. We do have a decompression table that's right behind you that we'll put people on that's true decompression for the lumbar spine. One more, Gail. Relax your shoulders.
Sure.
You feel a good stretch there?
Uh-huh.
Good. Good. Now his upper back didn't quite move that well face down, so I'm gonna do it face up, big hug. Roll towards me. Let's lower this headpiece just a bit. There you go. And right back on my hand. That's better. A little bit of the shoulder. Let's do your sinuses. So we do sinus drainage on a lot of people that come in. If you're getting sinus headache or pressure, the neck adjustment does a lot with helping things drain, for sure. But we also can kind of just get in and just do the sinuses. And again, with all the cold weather and people going in and out from the heat to the freezing cold, that we've seen a lot of sinus congestion and like head colds, that a neck adjustment and sinus work could definitely help. You okay?
Mm-hmm.
Slide down a little bit more towards your feet.
Sure.
There you go, you're tall. One more this way. I just want to make sure we got it all. Yeah. And this way, one more. Just relax your shoulders again. Okay. I think you've had problems in the past with them, but if they're good, we can let them go. This way for me. And deep breath in again. Exhale, Gail. Just relax your shoulders. Good. Again, we're adjusting his right here. That's kind of L3, L4, L5. Again, that's where he gets a lot of his tightness in his low back. Okay. Shoulders, please, come on up. I'll get on that side. Making me move, Ashley. All right, so again, we do this basic shoulder adjustment for his glenohumeral joint. It's a ball and socket joint in your shoulder, which can sort of shift forward. He even has a little bit of forward shoulder. So we'll give him some exercises to help strengthen his mid-back so he keeps his shoulders back better. But shoulder adjustment, relax that arm for me. Good. And this one, relax that arm. And that's it. So that's his full spine adjustment. Shoulder, neck, pain, sinuses. So thanks for watching.